We will begin back at District A, this time beginning with Mr. Coleman. The question is as follows. Quality and comprehensive health services continue to present a dilemma for New Orleans residents. What are your suggestions to making mental health services better?
Well, number one, as a city, we don't fund most of that health services department. Usually we get a lot of aid from the state. That's something that our legislative buddies have to go to Baton Rouge, and we have to decide on how much we can funnel and how much they can put forth. Everybody wants to have it, but the bottom line is how we're going to pay for it. And we can sit here and we can tell you that I'm going to do it, but at the end of the day, if you look at us 4 years from now, we'll say re-elect me, and it still didn't get done. So I don't have all the answers, and I'm willing to work with those that do, and that's what the Blue Ribbon Committees are. And right now I have to go and make my vote for the Democratic Party for our endorsement meeting. So I'd like to thank everybody for coming out, Urban League and Dillard University for hosting this. I'm Jason Coleman, number 21. Thank you.
Thank you. Ms. Guidry?
Thank you. The mental health, the short number of beds, the lack of treatment availability is something that we've been dealing with over the last 4 years. I've participated in a mapping of mental health services to help us to find out where mentally ill people wind up getting into the criminal justice system and instead get them to mental health treatment. So we're working on that right now, and it's a big project. Also, I've held council meetings, committee meetings on the mental health crisis and brought together state and local officials that have created conversations that are, wow.
Thank you, Ms. Guidry. Mr. Ward, 45 seconds, please.
Eventually, probably the worst thing that will ever be on Bobby Jindal's record is going to be the fact that he has dismantled our public health care system. Louisiana has had one since the 1700s, and he's destroyed it, especially mental health providers. Currently, if you have to go to a state mental hospital, your parents have to drive all the way to Alexandria to see you now. It's ridiculous. We have to take care of mental health services here because it's one of those things that in a society is either preventive medicine or reactive law enforcement. Either you take care of people who have issues and you keep them healthy and support them, or you deal with the fact they're trying to jump off a building, or they just shot somebody or stabbed somebody. It's two choices there, and it's just one of these things where you bite the bullet and you have to do it. It's going to cost money, it's going to take effort, but we can do it.
Ms. Ramsey?
I always believe that it's not over until it's over. There has to be a strong voice for the citizens of New Orleans to ensure that we work with our legislative body to return the inpatient services in hospitals back to New Orleans. Another issue, while having the honor of sitting in juvenile court on a pro tem basis, a lot of the issues that the juveniles are facing are a result of mental health issues that they have or that family members have. Offering early intervention and services to families so that we can reach them before they get into the criminal justice system is the second thing that I would do. Thirdly, I think we have to be very aggressive in assuring that we have proper and adequate outpatient services within the city and that we identify and reach people who need those services.
Thank you. Mr. Williams?
Just to be straightforward, the city council have very little to do, but you have the state representatives in that district that you need to hold accountable and communicate to Baton Rouge. And if you have to communicate yourself to Baton Rouge, that we need the funding. And that's the bottom line to that. And what we need to do, we have more people with mental health inside of OPP locked up, as one of the previous council members said before, and they sat there. So we need to do something about it, but then we have to really put some pressure. Hopefully Jen will be out of here pretty soon in that, but hopefully we need to put some pressure on the state representatives, state senators to push funding for the city of New Orleans and stay on it, not just pacify it.
Time.
Keep pressuring.
Dr. Bowie?
As a leadership entity, specifically the mayor and the council, we have totally shirked our responsibilities. To say that the state and others should have the responsibility is irresponsible. We should, in fact, be ensuring that our citizens have everything they need, including mental health services. We have totally dismantled the social service department for the city of New Orleans. We don't fund it, not one penny. We've gotten rid of the program completely. The Human Service District, which is a state-funded entity, is responsible for providing what we should be providing. We don't provide one penny for substance abuse treatment in this city. And so for us to continue to do that, we can only expect that if we as a leadership, meaning the council and the mayor, don't in fact re-implement that social service department and begin to fund those services for substance abuse treatment and mental health services, we will have a serious issue on our hands.
Thank you, sir. Mr. Brissett?
Thank you. Mental health is a big issue post-Katrina in our city, dealing with all the disasters that our citizens throughout the Gulf Coast have gone through. As a member of the Budget Committee, Appropriations and Joint Budget, I saw the priority of mine to see that the Metropolitan Human Service District has the funding that it needs, because these citizens do not belong in OPP. They belong getting services from Dr. Calvin Johnson at the Human Services District. I'm happy that I've authored and passed legislation, the Mental Health Preservation Act, 2 years ago, and very happy that I've worked with Children's Hospital to enhance adolescent mental health care at the Children's Hospital site. We just passed that legislation last session, and I will continue to...
Thank you. Mr. Savoy?
I would think that mental health and also Medicaid is a very important issue for our state legislators to deal with. So I would work with Mr. Jarrett as a state legislator to work on that issue. I also believe that since I have a background in public health, I understand the Medicaid system very well in terms of the program provides me the services to children. How can you be against providing services to children? I mean, that's just unconscionable in my book. The Metropolitan Human Services District is probably underfunded, so they really can't provide mental health services. They moved the program from New Orleans Adolescent Hospital to across the lake, and now it's moved someplace else, and it's a private venture. We have to work with our state legislators, like Mr. Jarrett said, to deal with that issue.
Mr. Kelly?
This brings back the point of my hopelessness and depression, and how that's such great contributors to the ills that we have in the city. If the state is adamant about taking away NOAA, New Orleans Adolescent Hospital, and the mental health services that we have or had here in the city, I think we need to push for a public-private partnership with the city and certain entities, local entities here that provide those services. Because we have, like Center for Hope in New Orleans East, they provide the services, but they're underfunded, and they can't. Their reach is limited because of that.
Ms. Willard-Lewis?
We must understand that the lack of mental health care in our city is a direct contributor to the violence in our city. And we must deal with appropriate strategies that develop a continuum of care with adequate state dollars where those dollars are available, to deal with counselors in our schools, which no longer exist, all the way to the end where we have adequate beds for in-service treatment in hospitals for the chronically sick or the ones that are in desperate care of need and attention. Secondly, we should support Obamacare, and we should make sure that this state gets every federal dollar available to it, and that our governors stop refusing money that the federal government wants to push down.
Thank you. Mr. Capasso?
Amen, Ms. Williams. To piggyback on that, we've got to start by calling out the people who have dismantled this system. Governor Jindal and his cronies, starting with Alan Levine 5 years ago, who threatened people, who made stop the threat. We would try to stop the closing of New Orleans Adolescent Hospital. So if you keep fighting that fight, we'll shut off some community clinics. And then saying Southeast Hospital is the greatest hospital we've had in the South for mental health care, close that. Calling out people that have dismantled this system and continuing to marginalize this issue. On January 16th at the City Council chambers at 6:30, we're going to pack the House to say demand to Mr. Jindal to stop the cutting of the Medicaid expansion. But again, Medicaid and the Affordable Health Care Act, the sham of people who have suppressed this program, because on January 1st, mental health care and substance abuse is covered. Thanks.
Thank you. Mr. Capasso? Okay, speed round. Here we go. Mr. Capasso, why don't we start with you? Do you feel that the minimum wage should be raised? Yes or no?
Is a yes or no question?
Yes.
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 Definitely yes.
Triple yes.
Yes.
Absolutely, Les, yes.
Yes.
Emphatically, yes.
It is unanimous. You're all hired. Thank you, candidates. We will now have our closing statements. You will have 1 minute to prepare for your closing statement. We will go in reverse order, beginning with Cynthia Willard-Lewis. Yes, ma'am. Closing statements, please.
At the end of the day, it's about a plan of action, inclusive of the voice of the people that you have been sent to represent, and a body of deliverables that make the district you serve have a quality of life for the families who've made investments there. That is exactly what I've done as I've served as state rep, state senator, and district council person. Whether it was before Katrina or after Katrina, with the things that were washed away, like the Lawless School Clinic, we've got a new Lawless coming up, or the Desire Housing Development. There's a new Desire Housing Development back. Joe Brown Pool built twice. The